Did you know that children today are more prone to degeneration? Today, you will discover why children need spinal hygiene and specific exercises to help them maintain proper alignment, motion, and strength. Hi there, I'm Dr. Krista, founder of the American Posture Institute, and your host on PEDS Week Online, the Pediatrics Virtual Summit for healthcare professionals. It's an honor to introduce our next guest presenter. Dr. Tabor Smith, founder of the Spinal Hygiene Movement, is a practicing chiropractor who runs one of the largest chiropractic offices in the state of Texas. He's a teacher and lecturer, teaching an extensive course on spinal health and hygiene through Life University's postgraduate education department. He trains chiropractors and their staff in the area of diagnosis, treatment, and prevention of degenerative disc disease. Dr. Tabor is also the executive producer of a feature-length health documentary titled A Better Way. Today, you will discover why pediatric patients need spinal hygiene to prevent spinal degeneration. Dr. Tabor, thank you for joining us on the Pediatrics Virtual Summit. Please take it away.
So the title of my lecture today is Why Children Today Need Spinal Hygiene Just as Much or More than they need dental hygiene. These are my kiddos right here. You're seeing my twins, Jace and Jaden, and they're growing up learning that it's important to take care of your teeth, but it's also important to take care of your spine. I'm Dr. Tabor Smith, and I've been a chiropractor for going on 15 years now. I've been practicing in the state of Texas. And as mentioned, I'm the executive producer of a documentary titled A Better Way. I currently am in practice 5 days a week. I'm very proud that we've seen many patients through our office, entire families in many cases. I've given over 180,000 chiropractic adjustments in my career so far. Again, something I'm very proud of. We see families that come in our office for wellness care and for checkups. And I believe that better patient education leads to better patient retention, which then leads to better patient results in your office. And so just diving right in, why do kids need spinal hygiene? Why do we need to start thinking about prevention of degenerative disc disease? Well, this was an article that was published in the back letter back actually in 2004. So I guarantee you posture has not gotten better since then. And the title was Shock Over Disc Degeneration in 10-year-olds. What Scottish researchers did was they took 154 asymptomatic 10-year-olds without any pain, and they put them through an MRI. And when they looked at the spine, they were surprised to find disc abnormalities or the beginning changes of degenerative disc disease that are already happening in 9% of those 10-year-olds. And even the researchers themselves, now these weren't chiropractic researchers, these were medical doctors, medical researchers, and they even said, look, is it really a surprise that we're starting to see this in younger ages because of the amount of sedentary lifestyle that we're seeing in these age groups, right? So is it really surprising? Not really. Anywhere you look, you're going to see poor posture. You're going to see kids that are on technology. Screen time is exploding in our society, in our culture today. In fact, if we're just looking at adult numbers, this was from the Chicago Institute of Neurosurgery and Neural Research. They said that adults, and these were asymptomatic, again, cases without any pain, that over 85% of adults by the age of 50 are starting to have degenerative disc disease. And again, asymptomatic means no pain, right? Well, the Center for Disease Control actually says that by 2040, an estimated 78 million or 26% of US adults, and that's children right now, right? So in 2040, our children will be adults, will be projected to have doctor-diagnosed arthritis. And when they mention the term doctor-diagnosed arthritis, that means symptomatic arthritis. That means pain that actually sent them into the doctor to be diagnosed. And so the CDC knows that degenerative disc disease is getting worse, and it's what we call the silent epidemic because you don't always feel it. It's kind of like that cavity. Do you feel a cavity when it starts? No, it has to progress to a certain size, to a certain degree, to actually irritate pressure on a pain fiber before we know a cavity is there. So why do children today need spinal hygiene just as much or more as dental hygiene? All of those numbers that I just covered with you in statistics for degenerative disc disease and the amount of screen time that kids are getting, that's pre-pandemic numbers, all right, pre-lockdown numbers. So you could probably multiply that by 10 in today's children, right? And these are pre-pandemic or pre-lockdown numbers right here from the CDC. In fact, this came from January 2020, which at least in the United States, our lockdown wasn't until about March or April. So before that lockdown, the Center of Disease Control and Prevention reported that children ages 8 to 10 spent an average of 6 hours per day in front of a screen. Kids ages 11 to 14 spent an average of 9 hours per day in front of a screen, and youth ages 15 to 18 spent an average of 7.5 hours per day in front of a screen. Now imagine those types of numbers actually getting worse, and that's exactly what happened, right? So here's the big question. Is there anything that we can do about this? And what I want to share with you is that we've seen a phenomenon we've seen before. In fact, in the late 1800s, early 1900s, a phenomenon like this happened in dentistry. If you look at this article that was published in 2013, sequencing ancient calcified dental plaques shows changes in oral microbiota with dietary shifts of the Neolithic and Industrial revolutions. And what they show is there were two major dietary shifts that happened in human evolution. The first one about 10,000 years ago, but the second one more recently, about the turn of that late 1800s to early 1900s. And that was what we call industrialization of food, and processed flour and sugars became a major staple in our diet approximately about 1850. Now, I've read several articles, and one of them showed that in the early 1900s, average ate about 2 pounds of sugar per year in their diet. Today's numbers, the average American eats about 152 pounds of sugar a year. So with that explosion of sugar in the human diet, what dentists saw was an explosion of cavities and tooth decay that happened around that turn of the century. So why did dental hygiene all of a sudden become so necessary in the early 1900s? If you were a dentist, and look this up, if you were a dentist practicing in the early 1900s, the main thing that you did was pull teeth all day long. And what they started to see was that tooth decay was happening at younger and younger ages because of the dietary factors that were happening there at the early part of the century. That was changing our behavior. So they had to adapt, they had to change, and human behavior had to change to help that phenomenon so that humans could have lasting dental health, right? And so today, because of what dentistry did, they implement dental hygiene procedures. We brush, we floss, we go see dentists regularly. We're seeing more and more people that are able to keep their own teeth throughout their life. So I'm arguing right now that a very similar phenomenon is happening in the behavior of humans, because humans are adopting technology at younger and younger ages, and it's causing more and more sedentary lifestyles. This phenomenon is having a devastating effect on the health of our children's spine and nervous system, and it's just getting worse as they age. So something has to be done on a mass scale in order to prevent this. Now, so what is it that we can do? Well, we know if we know the cause of something, then we could potentially create a solution for that, right? Like in dentistry, dentistry knew that bacteria actually digest sugar, and then the acid byproduct of that digestion causes the breakdown of the enamel or cavities or dental caries in the teeth, right? So that speeds up tooth decay. So their solution wasn't just to take all the sugar away, because they knew that they wouldn't be able to do that on a grand scale. Sure, they recommend dietary changes for their patients, and they tell people to avoid large amounts of sugar. But their solution wasn't really to remove all the sugar; it was to remove the bacteria on a daily basis, and then they could have an impact in people's dental health. Now, sure, you could brush and floss and you could go to a dentist perfectly, and you still may get some cavities and you still may get some tooth decay, but they could have a major impact in that process, right? Well, we know for a fact that poor posture and sedentary lifestyles speed up degeneration, or AKA lack of alignment in the spine, lack of motion in a spine, or abnormal balance or lack of strength around a spine. Speeds up the process of degeneration. We're starting to see it, in our colleagues who take a lot of x-rays in their practices seeing these degenerations happening, right, at younger and younger ages in their office. And I've even given you 3 different studies here that link sedentary lifestyle with degeneration. Tompkins et al., Buckholtz et al. In 2012, and Tremblay et al. In 2010. And you can take a screen capture of this image, or I will supply my slides for you, a PDF for those slides, so that you can actually access those documents and look at that. But we know it's really not debatable that abnormal posture, sedentary lifestyles, they do speed up the degenerative process of the spine. And so here are some posters from dentistry, and kind of what dentistry's approach is to brush, floss, and visit that dentist regularly. Yes, now they may recommend lifestyle changes, right? Like dietary changes, etc. And those things are smart, and we all should improve our lifestyle and our health. But what could we do specifically, both on a daily basis, maybe even regular visits to a practitioner, to influence the health of our spine and the health of our children's spine and nervous system? And that's why in our Spinal Hygiene Movement program, we teach patients how to properly take care of their spine. And similar to how dentistry says brush, floss daily, visit a dentist regularly, we say do daily spinal hygiene exercises and visit your chiropractor regularly. Regular chiropractic visits can help to improve alignment, motion, and strength. And then the daily exercises that we recommend can help you to maintain what you're getting inside your chiropractic office. So why regular chiropractic visits? Because we may have chiropractors in the audience, we may have other practitioners in the office too. So I want to address this question. Well, see, dentistry recommends regular checkups with a dental office because dentists are the only healthcare professionals trained to detect and correct cavities. And it's important to get early detection of those cavities and early correction of those cavities. It can make a difference in the health of your teeth. Well, once you have a cavity present, you can't simply brush it out, right? You need that dentist to be able to correct that, a board certified dentist to be able to correct that cavity. And so in chiropractic, we have a phenomenon called a vertebral subluxation. So in chiropractic, we recommend seeing a chiropractor regularly because we're the only healthcare professionals trained to detect and correct vertebral subluxation. What's a vertebral subluxation? Just to dive into that real quickly, one of my favorite models of vertebral subluxation is what we term the vertebral subluxation complex. And it really shows you that those factors, alignment, motion, and strength, are important. In this complex, we say that there are 5 components of that vertebral subluxation, and it could include alignment and motion irregularities. And so when patients come in, we're looking for those types of things. It could include a neuropathophysiology, like compressed or facilitated nerve tissues. It could include muscle or spasm, muscle weakness. And so that's why sometimes corrective exercises are necessary, not just spinal hygiene or what we term non-prescriptive exercises. Like a toothbrush is non-prescriptive, right? In some cases, if there's a subluxation or an issue or a problem, we have to actually go into prescriptive. And that means that you need to be doing a corrective exercises for a short period of time. We need to analyze when you're supposed to stop doing that corrective exercise, and then we move you back into non-prescriptive. Histopathology, right? There may be inflammation, there may be edema and swelling that's located in some of these subluxation complexes. And then ultimately, if that subluxation is left to continue to progress, then we're going to see degeneration, fibrous tissue, erosions, bone spurs, loss of disc height that can begin to set in. And so that's why it's so important to see are these types of complexes present in the spine, and correct them on a basis, or not a daily basis, but on a regular basis. And so we have patients that come in our office of all ages, but we see a lot of kiddos. And so here's pictures of me adjusting kiddos, and people don't realize how gentle it is. A chiropractic adjustment is so gentle. In fact, when we go through our education and our programs and our trainings for adjusting pediatrics, we learn that really you don't have to put much more pressure than the pressure it takes to kind of test a ripe tomato. So if you're in the grocery store and you're pushing on that tomato skin, that's about the same amount of pressure that we put on a child's spine to gently get that spine to move back into a normal alignment, and to make sure that these kiddos are maintaining their alignment, their motion, and their strength. And really what you'll see with chiropractic adjustments, I've seen amazing things, not just musculoskeletal issues, but a lot of non-musculoskeletal musculoskeletal issues. And I want to kind of touch on that for you, because a lot of people, when they think about chiropractic, that's really where they go, pain, neck pain, headaches, back pain. And sure, children can suffer with those types of issues, and chiropractic can really help them with that. But a lot of times it's even bigger than that. Here's a study that was published in JMPT, and it's titled "The Types and Frequencies of Improved Non-Musculoskeletal Symptoms Reported After Chiropractic Spinal Manipulative Therapy." And I love this study because they sent out, this was actually done with questionnaires, but over 1,500 questionnaires, and 86% of them returned. And they saw non-musculoskeletal symptoms improve in 21 to 25% of cases. And in those cases, the responses were 26% of them were related to airway passages, right? So usually reported as easier breathing. And that's because of that mobility of the rib articulations with the spine. And when we get fixations adjusted and moving properly, kids and adults as well can breathe a little bit easier. 25% of those were related to digestive system improvement, mostly reported as improved function. We see this all the time. I have parents that come in and their child's not going to the bathroom regularly, or baby has colic. And so adjustments can start to help that smooth muscle fire, and that smooth muscle can help to move digestive processes. In fact, I'll show you a picture here in just a second there of when that actually happened in our office with a little baby. And 14% under heart circulation improvements. About half of these were reported as improved circulation. And this one's a very, very important, very near and dear to my heart, because I have a child, one of the twins that you actually saw in the picture before, who was born with heart defects. He's had 3 surgeries, 1 open heart surgery. He's thriving. He's doing absolutely amazing after all of his surgeries. And I give credit to chiropractic, because we're checking him, we're adjusting him, we're making sure his spine and nervous system is healthy and functioning properly. And that nervous system is what controls his cardiovascular system as well. So, so very important. All right. But what about for kids? So I showed you a picture of our poster for adults, and we have 4 core spinal hygiene exercises for adults. And when it comes to kids, a lot of times we don't have them do all 4, exercises. We'll have them start with just 2, and 2 very simple exercises. One is just a range of motion stretch, where they simply take their spine through a full range of motion. And the other one that could be done at home if you want to, or if necessary, is called spinal molding. Now, I always say do this with your kids. And so if you look at dentistry, they did a great job of teaching us to take care of our teeth, but it's the parents' job to teach the kids how to brush, right? It's the parents' job to teach the kids how to floss. And so I encourage you as a parent, or you to encourage your patients as parents, to start doing these spinal hygiene exercises themselves, and then kind of work with their kids. Once their kids see you doing them, they'll want to do them with you, and it could be a lot of fun, right? So here's my twins, Jason, Jaden, and they're doing the range of motion stretch in our office for me. And it's really easy. All it is that you'll bend your spine 3 planes of motion, right? The 3 planes of motion are flexion, extension, lateral flexion to each side, and rotation to each side. And what you do is you'll have them hold this motion at the end plane. So if I bent in flexion, like I was going to go touch my toes, we would hold that motion for 10 seconds, and we count out to 10, right? And then you would extend back, like you're looking up at the ceiling with your full spine, and hold that motion for 10. Bend laterally to the end of range of motion and hold for 10. Lateral to the other side, hold for 10. Rotation to one side, hold for 10. Rotation to the other side, hold for 10. And think about that. That's 6 positions that you're holding for 10 seconds. It should literally take you and your child 60 seconds to do this exercise. How long does it take you to brush your teeth, right? Maybe that long, or even a little longer. And so these are so easy to start doing on a daily basis, and start implementing into your daily habits and your child's daily habits. And if you look at your patients, I guarantee you're going to see, maybe not all, especially if you're running like sports types of clinics, but a vast majority of people out there don't exercise. They don't go to the gym. They don't participate in athletics. And many of them might even be be behind a desk for 8 to 10 hours a day. And then they get home and sit on a couch, and they are literally not taking their spine through its full range of motion ever. Now, for years, they might not take their spine to its end range of motion. And so if you're implementing this, they might not be doing it perfectly, but if they're doing it just a couple of times a week, at least they're taking their spine to its end range of motion, and maximizing and maintaining that motion. And so I always tell my patients, it's a great way to keep and maintain the motion that we're helping you to get in our office. right? And then the other exercise that could be included, it's a little bit harder to get a 6-year-old, 7-year-old to lay still. But you know what? If you're doing it with them and you're teaching them how to do it, sometimes it's a lot of fun. And we have little spinal molding rolls, we call them. But a parent could simply roll a towel if they wanted to, and place one underneath the curve of the neck, underneath the curve of the lower back. And I tell my patients that this could help you to maintain alignment of the spine, or at least the curvatures of your spine, between your chiropractic visits. Now, we know that alignment is extremely important, and we talk about it in the term of posture quite a bit. But you can look all the way back to the 14 and 1500s in the studies and the drawings of Leonardo da Vinci. He was one of the first people to actually dissect cadavers, and he drew what he found. And if you look all the way back to his drawings, his actual drawings, you'll see he drew the spine straight from front to back and having natural curves from the side. And that's the same drawing that we're teaching academics today in all anatomy books, is that spinal alignment should be relatively straight from front to back. It should have natural curves from the side. And when the spine deviates from that alignment significantly, it can irritate, and it can affect function of those nerves, muscles, ligaments, and tissues around it. And so by having yourself and your patients do these types of exercises on a daily basis, and then I believe also visiting a chiropractor on a regular basis, we can help them to maintain those 3 factors of spinal health: alignment, motion, and strength. And by doing that, we can play a major impact in reducing the effect of degenerative disc disease, which is becoming the most damaging, in my opinion, the most damaging disease to humans right now. One, because it's silent, and we don't know that our kids are affected by it until they get big enough to have symptoms. And so we can make a major impact in the health of our communities, our patients, and our culture. All right. So I hope that helps. I know we didn't dive into a lot of the specific exercises, but in generalities, we've got to start teaching patients to take care of their spine at younger ages, to take care of them more consistently. It's not perfect. It's about being consistent. I tell my patients all the time, if you brush your teeth once, it's really not going to make a difference. It doesn't even matter, really. But if you brush them consistently over years, 10 years later, I guarantee you're going to have healthier teeth, because you were taking care of them over those years than if you didn't. And it's the same way when it goes to taking care of the spine. All right. So here's my information, and feel free to contact me. Love to answer any questions. Thanks, Dr. Krista.
Absolutely. Thank you so much, Dr. Tabor. What a wonderful presentation. I'm going to go through a quick summary and then a couple questions for you before we wrap up today. Now, you started by talking about a research study from 2004, and there was shock over the fact that even 10-year-olds that were asymptomatic were presenting with disc degeneration. And we can only assume that this has gotten worse with the onset of the digital age, spending more time sedentary in front of screens. Now, you talked about degenerative disc disease, asymptomatic adults more than 80% over the age of 50. So we have to remember this key component, that it can be asymptomatic. And the CDC says that by 2040, 26% of US adults will have arthritis diagnosed by a practitioner. Now, this is relevant because that means that even more will go undiagnosed. So more than 26% of US adults. And as you mentioned, those are children today. So the children today will lead to minimum 26% presenting with arthritis, unless, of course, we do something now. This is a silent epidemic because we don't always feel it. Kids are spending 6 to 9 hours per day on screens, if not more at this point. So what can we do about it? And you show a beautiful parallel among dentistry and the chiropractic profession. With dentistry, if we look back about the 1900s, there was 2 great dietary shifts of human evolution: more flour, more sugar, resulted in increased cavities. And instead of sitting back and just allowing it to happen, we saw a big shift in the dental industry. So humans are now, from our perspective, with postural correction, is that humans are adapting to technology at skyrocketing rates. So just like we saw, the integration of sugar leading to more cavities, we're seeing more sedentary patients spending more time on screens, and how this is having an astounding impact on their posture and leading to degenerative disc disease. So at a mass scale, we need to make an impact and make a change. If we know the cause, we can create a solution. So studies like sedentary lifestyle and degeneration Poor posture and sedentary lifestyle speeds up the degenerative process. With dental, you talked about brush, floss, and visit a dentist regularly. So that's really easy, bite-sized, memorable components that anybody can remember about their dental hygiene. So with spinal hygiene, you talk about alignment, motion, and strength for spinal hygiene and regular visits to a chiropractor. And when there is a subluxation complex, it can be a combination of spinal kinesiopathology, neuropathology, myopathology, histopathology, and pathology leading to a degenerative disc disease process. You talked about a great study from JMPT showing that improved non-musculoskeletal symptoms from chiropractic care, about 21 to 25%, showing increase in airway usage, so clear airway passage, improved digestive system function, and improved heart circulation. And then with pediatric patients, you recommend a couple of exercises for spinal hygiene. Number one, range of motion, stretch, going into flexion, extension, lateral flexion, and rotation, holding on each side for about 60 seconds at in range. Holding for 10 seconds at in range, about 60 seconds total. And then spinal molding. And then you recommended for parents to do it with the child. And then recognizing that deviation from normal spinal alignment can impact muscular, neurologic, and skeletal function. Dr. Tabor, brilliant presentation. Couple questions for you.
Sure.
Number one, how long do you recommend spinal molding for children at home?
Great question. So we start off with just 5 minutes, and then you want to see if that elicits any type of soreness or, we find that a lot of people, if they've lost those natural curves, and when they first start molding those curves back into proper alignment, there can be some soreness associated with that. It's perfectly normal, and that's why we start with 5 minutes. And we have them build up to 10, 15, and even with an ideal goal of 20 minutes laying on those rolls.
Nice. And what do you recommend for children who, perhaps during the pandemic or even ongoing, are at home on screens learning from home, and they're just seated on the couch, staring at a screen? What would you recommend for good solutions for active sitting to prevent that sedentary lifestyle?
Yeah, great question. So there's no substitute for motion and for movement, right? So there, a lot of people are talking about sitting being the new smoking, that it's affecting our health so much, right? Now we do supply what is called an exercise disc in some cases, or an exercise ball, and have people sit. And really, what that does is it makes things a little less stable, right? And so what happens is your core and your balance has to activate, and that can sometimes activate muscles. It can fire nervous system, and you want to do those types of things as you're sitting. If you can get an exercise disc or an exercise ball, and at least for a portion of the amount of time that you have to sit, use those kind of non-stationary chairs. I think that's a great idea.
Yeah. And, because what ends up happening is that an old office chair or an old school desk will hold the body upright. And so we end up outsourcing our brains and our bodies to the chair instead of actively engaging our core musculature. And then hours will pass and we realize that we haven't even moved at all. So I love that recommendation. And then, from a practice growth perspective and increasing education to patients, what would you recommend? So, let's say that you have parents coming in and they have children at home. Is your first recommendation to do spinal hygiene, doing exercises as a family at home? Do you recommend they come in for posture checks? What does that look like with that referral process to work with whole families?
Yeah, no, great question. And I would absolute recommend that checkups and posture checks for everyone in the family. And then beyond that, when we do give high exercises, I think the important thing to understand there was where there is a difference between prescriptive and non-prescriptive exercises, and that those spinal hygiene exercises typically are non-prescriptive, meaning I can tell them, share this with your whole family, right? Share with friends. And that in itself can generate referrals, right? Because now they're starting to build this awareness that, oh, I was supposed to take care of my spine. I had no idea, right? And now they're starting to do that. And that can generate awareness for chiropractic even in general. So when a patient comes in, let's say the mom presents out of the family first, which does happen quite a bit. If we look and we analyze posture and we see that she has a right lateral shift, I might prescribe a left reverse posture exercise for her. But that's a prescription, meaning I'm going to tell her, don't share this with your spouse because you'll mess up his spine if he doesn't need this exercise, right? And then I'm also going to tell her, well, here are the spinal hygiene exercises, which will help maintain alignment, motion, and strength for everyone. And these are non-prescriptive, and please do share these with your spouse.
Oh, I love that. Yeah, the difference between prescriptive and non-prescriptive, being very specific to that patient's individual postural distortion patterns, and then also recognizing how we can share the conversation with more people, including your family, your spouse, as well as your colleagues at work as well. Dr.
Correct.
Tabor, thank you so much for a wonderful presentation. As we wrap up another great session on PEDS Week Online, Dr. Tabor, I'd love to acknowledge you for the amazing work that you're doing with the spinal hygiene movement. Thank you for leading the way. Thank you for leading the charge. And thank you for showing us what's possible with spinal hygiene. I'd also like to acknowledge you, the healthcare provider, who's learning up-to-date clinical solutions to serve your patients at a higher level. I'm Dr. Krista, your host on PEDS Week Online. Be sure to get the Pediatric Clinical Pearls Super Pack for ongoing summit access and tools for simple implementation into your practice. Stay tuned, and we'll see you on the next Pediatric Masterclass.